asking globbing. Gloves actually suggest for prevention, and would it give a extra this false protection idea, believe gloves?
This is add-on. Gloving is not considered as the it is add-on in a routine practice. So in a routine clinic, you are not gloves, you use the procedure.
What our people see things.
Pneumonia. Consider HRCT in healthcare workers on day 3 of illness. That if you need up to liters of oxygen in the home care in the first 9 days, you can add Montelukast, as the case may be, famotidine, and give add cetirizine if allergic component is high, in addition to consider colchicine during for a few months till that BCG or MMR immunity is lasting. That's one. Second is that it also produces indirect cytotoxic immunity, non-specific, which may also help. So these are like strategies to reduce the viral load or strategies to reduce the severity of the disease. That's it.
President, just a quick question. What is that 777 that you refer to? I'm sorry, I didn't catch that.
This we have discussed in the past. 7 days duty, 7 days quarantine, 7 days in the home.
I see. Thank you.
7 days you do a duty, then 7 days you are in quarantine, then 7 days you are with your home, then come back for duty.
Yeah, I recall that.
Mr. President, I was asking you about the air-conditioned room. Mr. President, I was asking you about the air-conditioned room, where we work actually, what special protection.
In an air-conditioned room, we recommend a air purifier, because air-conditioned room, this is recirculating. Window AC, things are different. In a window AC, you have a mode where you can put down outside air. But in a central AC and in a split AC, you cannot. So therefore, their portable air purifiers are a must.
Yeah, PRP is the okay. Thank you. But it's problem is that it's a actually costly thing, and everybody cannot afford. And most of the air conditioners now are split.
We are only discussing the clinic. The cost will have to be borne by the patient, because 500 lion buy in India specifically. If you can buy a clinic worth tens of millions of dollars rupee, you can also buy a air purifier. You can also buy a central AC. What I mean to say, it's a question of life and What I mean to say, it's a question of life and death now. 500 death is not acceptable in India. Big number.
Don't you think about this is the problem of infection control? which I have seen in Bangladesh also. Initially, there are a lot of lives actually we have seen gone. Now it is contained actually in Bangladesh, and more actually attention has been given to the infection control and prevention.
You have to remember that in India, Pakistan, Bangladesh, Nepal, people are opening clinics in their garage. People are opening clinics in the closed areas. All the clinics are closed areas. If your clinic is an open area, no further recommendation is required. But most of them are running in their houses, in their garages, where the car is supposed to be there. They have converted them into clinics, and that's a complete chamber box of COVID-19. This problem may not be there in Singapore because they have the luxury of a big clinic. But I'm talking about in areas where you are opening your clinic in a closed area, you need to prevent them. Yes, Dr. Pillai.
Okay, doing ferritin level, I think it has some significance, particularly now the theory that is being more accepted is that virus cause disintegration of hemoglobin, and that produces more of ferritin, and this ferritin is highly inflammatory, and that causes more of lung damage. And another aspect is, since there is disintegration of hemoglobin, sharp fall in hemoglobin is one reason why they have a happy hypoxia, because the distress is not there, but the hemoglobin oxygen carrying capacity is reduced, and particularly those with hypoxia, oxygen saturation low. Do you think that
I agree.
level
Dr.
estimation? Yeah.
I agree. Hemoglobin fall from 1 to 2 is a rule in COVID-19. In every patient, we have seen a fall of 1 or 2. Ferritin, I have not included purposefully because if I include ferritin, I have to include LDH, IL-6, D-dimer, everything. I've written down the minimum testing and the most important testing. Liberally, you can go for any testing because IL-6 is equally important, red distress, LDH is equally important, D-dimer is important, but then each test is costing 4,000 rupees. So therefore I put down minimum test which can give you a clinical clue for management. Rest you can do whatever you want. For me, CRP is the most important because if the CRP is normal, hemoglobin cannot become low. If the CRP is normal, IL-6 cannot rise. If the CRP is normal, the D-dimer cannot rise. Because the fall of disintegration of RBC is because of inflammation, and the marker of inflammation is CRP. That's why I included only one test, and that's the reactive protein, which indirectly tells us about ferritin, D-dimer, IL-6, and ESR. But I agree with you. Ferritin is very important. Ferritin is very important, but I am not going into the details. Do minimum base, do baseline minimum I like.
Can I just ask you, just if you add these things in a second line, because we are asking for healthcare worker, you are telling. So in that case, actually, no stone should be unturned. So D-dimer and others should be done if the concern is about the healthcare workers.
IL-6,
Yeah.
ferritin, D-dimer, IL-6, RWD, LDH, fibrinogen level.
President, as options or mandatory? I think as options, right?
Add to the clinical, add to deciding the clinical severity. So ferritin, D-dimer, but D-dimer, IL-6, then TNF alpha, RDW, LDH, fibrinogen levels, add to, what did I say? Add in deciding the clinical severity.
RDW as in red cell width, President?
Yes, go ahead.
As in red cell width, RDW?
Red cell width, yes, more than 14.5 is
okay.
significant of. If it is more than 14.5, it's a sign of severity. Everything has a number. Ferritin more than 1, D-dimer more than 1, IL-6 more than 26, TNF alpha, RDW more than 14.5, LDH more than twice, fibrinogen more than twice, may add in deciding the clinical severity. But they all, so for example, if CRP is normal, I did not go to them, because they all will be normal, because the first to rise is IL-6, second to rise is CRP, third to rise is fibrinogen, and then comes other things. With a normal CRP, hemoglobin cannot go down, because hemoglobin is a sign of inflammation, and the sign of a marker of inflammation is C-reactive protein.
Yes.
See, then if it is a, say I am basically putting CRP because in a resource limited countries in Asia, CRP is the most important.
Yes. Point taken. Thank you, President.
ESR basically is for recovery, not for the acute management. ESR may take 1 month, 2 months to recover. Anybody else?
May I just request you, Mr. President, that would you please send the slides actually in slide form to us so that actually this can be ventilated to our medical association members and others like that.
I will.
Thank you so much. Thank you so much. Thank you so much. And one more thing, if I do not forget, one more thing. I don't know, not about this actually, just because from 26 to 30 we are having the WMA assembly, and could you just request them to make a room for CMAAO, because in WMA assembly actually we used to meet, so this sort of meeting actually will be strengthening our position.
Can you write this to organize a CMAAO meeting in parallel for 1 hour? Chair can write to the head office with a copy to me, and we can have a 1 hour parallel session as association are having. So we can have a mini luncheon meet. Lunch can be flexible. So a regular luncheon meet we can have.
Yes.
I would like to add one more point. There is in CMAAO countries, dengue, lepto, chikungunya, and tuberculosis. All these infections can coexist. So on the basis of high clinical suspicion, maybe these tests also have to be done.
I'll put down. Yes.
We can add on.
I'll put down. Yes. What I'm doing is I'm trying to make as much as possible guidelines and CMAAO consensus statements as possible, because that will work on our, that will become like a official document. Tomorrow I'm speaking on with the UNESCO platform. I'll be speaking on vaccines, the basics of vaccines. I'll request everybody to join tomorrow, because I'm trying to simplify understanding of vaccine as much as possible for everybody. Everybody is confused today. What is, how does vaccines work? So Dr. D'Souza has invited me to speak tomorrow.
Yes. All of you are invited. I sent you. It's being run with the UNESCO and the Society for Disaster Medicine and Public Health of the United States. They are going to be convening it. And I think from Israel, the Professor of Public Health is going to chair your session and the discussion with him.
Dr. Sajjad, you haven't spoken anything today, Mari.
Where is Dr. Sajjad?
Mr. President,
Yes, sir.
thank you about the presentation. Is excellent. I would like to just express that in Hong Kong, we don't recommend putting on double masking.
Okay.
That is, say, if we advise people to put on double masking, I don't know whether we could remind people to put on double masking sometimes could be risky as well, not necessarily adding the protection. And rather, it's a level of the mask, surgical mask or N95 that matters. Say, if it is cloth mask is definitely not protective as the surgical mask. And surgical mask also would have level 1, 2, or 3, depending on the degree, the percentage of protection against the virus. And some of the masks are for industrial use, just to screen off the particles and not the viruses. So in Hong Kong, we don't recommend double masking. On the other hand, we would always couple masking with hand hygienes and the universal use of liberal use of the alcohol sanitizer, because water is not available everywhere, not to mention soap. So of course, availability of alcohol sanitizer is also a problem. But then hand hygienes we think is a must as well. When we handle the mask, when we take off the mask, or when we touch the mask, the fingertips could be contaminated, and that could spread the virus to the eyes, to the nose when we touch the eyes or nose as a gesture. Always we had touched thousands of times our face a day. So that's what I just want to suggest. Thank you.
Thank you, Alvin. When I meant double masking is for in an OPD over N95 mask, we wear a surgical mask and change that surgical mask after every patient we have seen. That was my idea of double masking. That is, in a OPD practice, to save N95 mask, we wear a surgical mask over the N95 mask and change it every time you have seen a patient. So you have a new surgical mask over N95. N95 you can continue for 6 hours. That was my idea of double masking. Because we are not discussing today double masking in the public. We are only discussing in healthcare workers. If you have N95 mask, you can add a surgical mask or a shield over it and change it with every patient. That was the idea. But your point is well taken.
Mr. President, I just want to include my view that one thing can be added on your guideline, that the doctor should wash or sanitize their hands after examining each patient.
So you have to put down as IMA guideline, WHO guideline, that includes that. We have hand washing to be done as per WHO protocol. WHO clearly defines 5 areas where you have to wash your hand and how to wash your hand. So
yes, can we include in the CMAAO guideline what you have said, the CMAAO and IMA guideline?
And after every patient is seen, specifically, yes, I've done it.
Good, thank you, sir.
If not, then Mari can speak, and then we can finish this meeting early because it was a specific agenda today. Mari?
Yes, thank you. I have to go also.
Thank you. I have nothing to add. Thank you very much.
So I'll request now Dr. Chong to formally summarize, and we can meet next time.
Thank you, President. It's most interesting to have gone through these guidelines. I think the situation really varies from country to country. So each country has its own set of issues and set of problems, and sets right now is really, really daunting. Some lack of resources in certain areas and so on. I think these guidelines are very, very pertinent and very important. especially to preserve the lives of healthcare workers who are under-resourced, underutilized, and overwhelmed. So I think these guidelines are very, very important to try our healthcare workers from perishing. Without much ado, thank you very much, and thank you